When are you eligible for Medicare? We'll discuss that next in a minute with Marty, so stay tuned. So, who is eligible for Medicare? Medicare eligibility begins for most people at the age of 65. Individuals who have been entitled to Social Security disability for at least 24 months also qualify. But there are other situations someone can qualify for Medicare who are under the age of 65. One, if you are permanently disabled and you've been receiving Social Security disability income benefits for 24 months. You have end-stage renal disease, which is kidney failure that requires you to get dialysis, or if you are waiting for a kidney transplant. And the third option is if you currently have ALS, which is also called Lou Gehrig's disease. But you may say, well, when can I first enroll in Medicare? If I don't fall under those conditions, when can I first enroll in Medicare? Well, it's 3 months before your 65th birthday, the birthday month, and 3 months after your birthday month. Eligibility for Medicare Part A. There are different parts of Medicare. You're eligible for Medicare Part A at the age of 65 if you or your spouse has legally worked at least 10 years or 40 quarters in the U.S. While working during those years, you and I pay taxes towards Part A hospital benefit. This is why most Americans pay no Part A premiums when they become eligible for Medicare. Part A mainly covers your hospital stays. If you have not worked the required 10 years to qualify for Medicare Part A at no cost, you can purchase the Part A. You can do a couple of things there. Contact Social Security. We will also have some of this information on our website at hfcbenefits.com yearly, and we kind of update that yearly as those numbers on occasion do change. In some cases, if you have worked between 30 and 40 quarters, that monthly payment may be prorated. So again, we'll have some of that information on our website, or you can contact Social Security and get that information as well. If you are already enrolled in Social Security income benefits at the time that you turn 65, you may be automatically enrolled in Part A and Part B. Your Medicare card will arrive in the mailbox about 4 to 6 weeks before you turn 65. But that's if you are already enrolled in Social Security income. Eligibility for Medicare Part B. You're eligible for Medicare Part B at age 65 as well. However, you must pay a monthly premium for Part B. This provides for your outpatient benefits such as doctor visits, lab work, surgery fees, and more. You can check out our Part B page on our website that breaks down more of what Part B will cover. Some people turning 65 still have health insurance through an employer. You can delay that enrollment into Part B in favor of keeping your group health insurance without fearing a late penalty. If you delay enrollment in the Part B, consult an insurance agency who specializes in Medicare. He or she can explain the special enrollment periods, which you must use later on so that you won't be subject to the late enrollment penalty. And one example is if you currently have a group coverage. Eligibility for Medicare Part C. Medicare Part C is another name for Medicare Advantage. That is one thing you see on the TV quite often. You can enroll in Part C if you wish to get your benefits through a private insurance company instead of original Medicare. Usually these plans have a much smaller network than Medicare, but some of them will include the Part D coverage that we'll discuss here in a moment. To be eligible for Part C, you must be enrolled in both Medicare Part A and Part B, and you must also live in the planned service area. Living in the planned service area is an important thing to keep in mind when you are enrolling in the Part C. You need to make sure your doctors and the hospitals are going to be there. You must also have, again, like I said earlier, both Part A and B to be eligible to enroll in Medicare Advantage or Part C, you must continue to be enrolled in Part A and B during the entire time. Many people think that if they enroll in a Medicare Advantage or Part C plan, that they can drop that Part B premium plan and drop the premium, but it is very important. Keep paying the Part B premium. You definitely want to do that. Eligibility for Medicare Part D. This is your prescription drug plan. You're eligible for Medicare Part D as long as you are actively enrolled in Part A and or Part B, and you must again live within the service area of the plan. Although we strongly recommend that you enroll in Part D coverage, it is totally voluntary, but we recommend that you do. Part D provides insurance against future catastrophic medication costs. I mean, you never know what tomorrow holds. You may be saying, look, I don't have any conditions now, I'll just wait. Well, if you do, you will acquire additional penalties in that premium because the government wants you to enroll at the moment that you are eligible to do so. So keep that in mind. Be aware that if you do not enroll in Part D, and you don't have that credible coverage, like example we used earlier, you at an employer, you've got employer coverage. If you waive it and you don't have other coverage, you will incur those late penalties. So worst case scenario, if you're turning 65 and you're taking Part A, Part B, you're doing Medicare Advantage, supplement, whatever that may be, and you're looking at Part D and you're not taking medications, just get the lowest cost plan that's out there, just in case, because the next month you may wind up with needing a prescription, and later on it would keep you from paying those penalties that would incur. So this was a very brief introduction into Medicare eligibility. Make sure you watch other videos listed on our YouTube channel or visit our learning hub at hfcbenefits.com that will explain in better detail each part of Medicare. Again, there's a lot of different parts, and that's why it's very important that you select a Medicare agent to sit down with you that knows all the parts of Medicare and can help you enroll in exactly what meets your particular needs. So again, I hope this was beneficial to you today, because this was A Minute with Marty. Have a good day.